Dr. Martha Whyte, Regional Director, Louisiana State Department of Health. Hey, Martha, welcome back to. See, we're on a first name basis now.
Wow.
Hey, Mart. Hey, Marty. How you been?
Actually, my husband first called me Marty the first time he met me, so I'll take that.
Oh, wow.
I was talking to a friend yesterday, and we were talking about the contagious level of coronavirus, and you can help me out with this one, because it seems to me that if people kept the social distance 5 or 6 feet, and people didn't rub their eyes, pick their nose, or lick their fingers, that we could, this is the most naive, silly sounding question of all. If you do those things, how can you catch it? It would seem to me it would really, like maybe a 1 or 2% chance if you do that stuff. Am I wrong?
No, you're not wrong. But everybody has to do it. And so when, someone comes to your work, or you're in a store and someone walks right up on you and is coughing or sneezing and not respecting that space, then you're at risk. And so everybody has to do it. We all have to take this serious.
On top of that, as now that we are paying really close attention, don't touch yourself above the chin without washing your hands first. I would bet someone who is as conscientious about that as you could be, I still catch myself 5 times a day screwing up. And it only takes one time, doesn't it?
Absolutely. And we are creatures of habit, and all of us touch our face a lot. When we're bored, we rest our face in our hand. We just do it. And so we have to be very conscious of the fact that we cannot do this right now.
Dr. Whyte, the elephant in the room, your husband is being treated for COVID-19 now, correct?
That's right.
And he is.
He is.
What can you tell us about how he's doing today?
Well, all I'll say is that he's very sick. He's in the ICU. I am blessed with amazing nurses and doctors and support staff, respiratory therapists, even physicians from outside of the ICU who are helping in his case. The healthcare workers in our community are just amazing.
Any idea how he contracted it? Is it hard? It's hard to know, I guess, right?
I think that someone working in another part of his office, not where he was, not his patient side, but another side, was sick. I think she came to work sick. And they caught no fever, but coughing, and they turned her home, but he was the one that interacted and sent her home. Didn't know this until just yesterday.
In your post about this, I could hear kind of anger in your voice, and you're generally a sweet, calm, reassuring person, but I could hear that you were angry about all the people that are ignoring the request to stay home. Are you feeling angry today?
Well, let me first say that post was supposed to be private. Somehow, because I marked another COVID post as public, it marked my whole thing as public. And I had to pray a lot about it and believe that maybe this is God's plan to use him and his story as a tool to educate people. I am angry. I'm angry that my family is suffering through this. I'm angry to see my children in pain and people who love him in pain, as well as myself. It's very painful. And it didn't have to be this way. People just have to do the right things. And, we have people being, cavalier about it, and then they're dying. I mean, there was a person who put a post on Facebook who said, well, if I die doing the thing I love. And guess what? He died. Wow. So you know what? It's not funny. It's not a joke. It's not something to just take lightly. All these parents who are letting their kids go to parties and go out on the lake and hang out together, shame on you. Shame on you. It is not right, and you are responsible for this continuing spread. We just have to do better.
Sounds to me like you're saying, and Aaron and I have said this on the radio for 2 weeks or more, is that your own self aside, as anyone can carry this disease, can transmit this disease. Symptoms and or severity of illness, it doesn't really matter. The point is that there is a moral imperative, I would think, to not get somebody else sick who might really, really become ill.
That's right. Let me tell you, my husband was obsessive. He took this serious before the governor locked anything down. He had one patient at a time in his office. He cleaned the room between patients. He used separate rooms and cleaned one room while another patient was in another room. Everyone wore masks. He was obsessive. He did the right thing. Someone else did not. So we can do the best we can, but everybody has to do that.
Martha, I'm going to get emotional when I ask you this, and I hope you understand, because I've known some people that have been sick, and I know some nurses in the trenches, and they've told me, Erin, this is so awful because the family members can't be in the room. You can't be in the room holding your husband's hand. You can't be there for him. All he's got around him now are nurses and doctors, correct? And no personal people that love him.
That's right. And in fact, the day before he went into the hospital at all, because he went straight from home to the ICU, and that's how fast it happens. He took a shower, got dressed, told me he thought he was feeling a little bit better, and I checked on him 45 minutes later, and he couldn't hardly breathe and couldn't walk to the door to get in the car without resting twice. So, yes, it's very frightening to not be able to be there with him. It's frightening. I had just said the day before when we had a 34-year-old pass away in our area, my God, she died alone. She died alone. That's a terrible thing. And we need to take this seriously. My God, people are dying. How much more can you say? Why does that not get through to people?
So our prayers with you and your family, your children. I know, I can't even imagine. And I hated to even text you. I hope you understand that. But people needed to hear people need to hear your story. I think it may help.
Well, I appreciate that. It's been hard to accept that it went public, but I guess it's for a purpose.
Dr. Martha Whyte, thank you. We're praying for you.
Thank you.